Okay, I just washed my hands. Hi, Mr. Workout. My name is Michaela. I'm going to be your nurse practitioner today. How are you today?
Good.
Okay, yes, you're very groomed very nicely. I don't see anything going on. Look great. So today, do you feel like you're depressed?
Yes.
You feel okay. Are you having any thoughts of suicide?
No.
Okay. Are you taking any medication for your depression?
No.
Okay. Do you see a therapist?
No.
Okay. Do you feel sad today?
No.
Okay. All right. So, how tall are you?
About 5'7".
5'7". Okay. How much do you weigh?
160.
160. Okay. And then I'm gonna take I did his vital signs. His blood pressure is 130/80. His heart rate is 86. His oxygen's 98%, and his temperature is 98.6. Okay, so I'm gonna inspect your skin. Okay.
Okay.
All right. Okay, so I'm gonna inspect your skin. Okay.
Okay.
All right. Okay, don't really have anything going on. No lesions, no nothing. Okay, don't really have anything going on. No lesions, no nothing. So right now his color is pink. He doesn't have any signs of, there's no lesions on his face. There's nothing going. Let's see, hair texture and distribution is all even. It all looks good. Now I'm gonna just assess your pulses, okay? Both pulses are there. See, everything looks symmetrical. Both sides of his face are. And now what I'm gonna do is I'm going to assess to see if you have any TMJ. So I'll note that by kind of feeling, and then what you're gonna do is you're gonna open up your jaw and then clench down. And I'm gonna hear for any clicking. Okay. Okay. Go ahead. Okay. No clicking has been observed. All right, and then what I want you to do is I want you to smile. Okay. Then what I want you to do is I want you to raise your eyebrows. Okay. I want you to puff your cheeks. Okay. And everything looks symmetrical, and this is the facial nerve. Okay, now I'm going to assess to see if he's able to, for the toothpick on either side of his face. Okay, ready? Do you feel that?
Mm-hmm.
Which side do you feel it? Do you feel it same side, or do you feel the same side? Do you feel sharp on both sides?
Yeah.
Okay. How about now? Was there any difference? Okay. Is there any difference?
Mm-hmm.
Okay, so now I'm going to assess his visual acuity by having him read off of the Snellen chart. Okay, so you're gonna basically close one eye, and then you're just gonna kind of go down the line of what you see by starting at the top. Okay, go.
E.
Okay.
E-P.
Mhm.
T-O-Z.
Mhm.
L-P-E-D.
Mhm.
P-E-C-F-D.
Mhm.
E-D-F. C-Z-P.
Mhm.
F-E-L-O-P-Z-D.
Mhm.
D-E-F-P-O-T-E-C.
Mhm.
L-I.
No. Can you not see it?
Y-O-U.
Okay. So that's all right. All right. So now we're gonna go to your other side of your eye, and then read down.
E-E-P-T-O-Z-L-P-E-D. P-E-C-F-D.
Mhm.
E-D-F. F, CZP, FELOP, ZD, DEFOT, EC,
Mm-hmm.
LEPOD, PCT, FDPLNCEO.
Okay, thank you. Okay, so now I'm gonna do the assessing your peripheral vision, and it's gonna be called the finger wiggle test. Okay, so you just tell me which finger you see, okay? Let me wiggle it. Okay, ready? Okay, good job. So now I'm going to assess his 6 cardinal fields of gaze with his eyes, okay? So when I point, you're just gonna bring your eyes up or wherever I point, okay? So this way. Okay. I did not notice any nystagmus. Okay, now I'm going to be assessing the symmetry of pupils and the shape. So. Okay, everything looks symmetrical. And now I'm going to be looking to see how his pupils are with the light shining on his eyes. Okay. Okay, so now I'm going to assess his conjunctiva. They are both healthy and pink. And then I'm going to assess his iris. They're both the same color. And I'm going to assess the cornea. Everything looks great. So now I'm going to assess his red reflex. Okay, go ahead. Okay, and the other side. No red reflex was noted. Okay, now I'm going to inspect his ear oracle. Okay. So I know that there's no redness, no infection, there's nothing bulging. Okay, let me assess your other ear. Turn the other one. There is nothing, again, there's nothing red, there's nothing bulging, and everything just seems the same color as the other ear. Okay, so now I'm going to be doing the whisper test. Okay, when I say something, you tell me what I say, okay?
Say hello.
Okay, on the other side.
Say hello again.
Okay. Okay, so now I'm going to perform the Weber test. Okay, so I'm basically gonna knock onto your elbow. Okay, ready? And you're gonna tell me what you hear. Do you hear in both ears?
Yes.
Okay. Okay, so now I'm gonna be performing the Renee test. So I'm just gonna tap on your elbow, and you're gonna tell me when you stop hearing the buzzing noise once I put this against your back of your ear, okay?
Okay.
So I'm gonna go to the mastoid bone. Wait.
I don't hear it anymore.
Okay, I'm gonna do on the other side too.
Alright, stop.
And that would be considered a normal finding. Okay, now I'm gonna assess his nerves for patency. Okay, looks great. Okay, there's no deviated septum. There's no redness. And okay, I'm gonna assess your frontal maxillary sinuses. You tell me if you feel that there's any pressure. Okay. So right now I'm doing his maxillary. Do you feel like any tenderness?
No.
Okay. How about right here in the frontal sinuses?
No.
No tenderness. No tenderness was seen or felt. Okay, so now I'm going to assess his mouth and throat. Okay, so you can go ahead by just smiling. Okay. Alright. So it looks like, okay, now I'm gonna assess your swallowing and I'm also gonna assess your voice. So just swallow like normal. Okay. And just, if you could just say hi.
Hi.
So it looks like his voice and his swallowing are both within normal range. Okay, so now what I want you to do is I want you to turn your neck side to side. Okay, and I want you to go back and forth. Do you feel any pain when you do that at all?
No.
Okay, great. Okay, so now I'm going to be assessing his cervical lymph nodes. Okay, so I'm going to start with the submental. And I'm going to be assessing his posterior auricular. Okay. I'm going to assess his occipital. And his superficial cervical. And his submandibular. And the tonsillar. And the pre-auricular. Okay, so now I'm going to assess his thyroid gland. So what I'm going to have you do is I'm going to have you drink water, and I'm going to go from the posterior approach. So I'll be behind you, and then you're just going to drink, and then I'll feel for anything, okay?
All right. Ready?
Yes. Okay. I'm just going to feel for any tenderness or nodules. I do not feel anything. Okay, so I noticed that they were brisk and there was no bruise or thrills. Okay, so now I'm going to assess his axillary lymph nodes. Okay, I'm going to go to the central. Okay, I don't feel anything there. Then I'm going to feel your pectoral. And then I'm going to feel for the lateral. And I'm going to feel for the subscapular. And I'm going to do the same on the other side. Okay, the central, the pectoral, subscapular, and the central. I don't feel anything. Okay, so now I'm going to assess the sternoclavicular area for tenderness. Does that feel like it's tender at all?
No.
Okay, now I'm going to assess the acromioclavicular. And then I'm going to assess the subacromial area. Do you feel anything? Here or here? Okay, no tenderness was noted. Okay, so now I'm going to assess his range of motion. So I'm going to see how he does with flexing his shoulder. So put your arm back, yep. Great. If you can stop, you can lower it. And I'm gonna have you abduction, so that means you're gonna bring your shoulders, or your shoulders out. Okay. And then you're gonna bring them in, which is adduction. Okay. Okay, so now I'm going to test your shoulder shrug, okay, against resistance. So I'm gonna place my hands on your shoulders, and then I'm gonna try to bring them down as much as I can, and you're gonna push them up. Okay, go ahead. Okay, bring them down. Okay, good job. Okay, so now I'm going to assess the epitrochlear node and his elbow node. Okay, I don't see that there's any, lymph node that's inflamed or bulging. And I'll assess the other side. Okay. Okay, so now I'm going to assess the supination, which is you're going to bring your elbow up, and the pronation, which is bringing your elbow down. So go ahead and bring your elbow up and bring it down. Okay. I'm going to assess his chest wall. Okay, so I know that there's no barrel chest. I know that he is breathing normally and he has no signs of distress. Now I'm going to hear for any bruise or thrills on his carotid arteries. Okay, so I noticed that they were brisk and there was no bruise. Now I'm going to be assessing the heart valves. So now I'm going to go to the aortic, the pulmonic, and then the tricuspid, and the mitral valve. Okay, everything looked good. Okay, so now I'm going to be assessing his lung sounds. All right, so just take a deep breath. Just move up a little bit. I did not hear any crackles or any fluid buildup. Everything sounded great. Okay, so now I'm going to assess the posterior chest wall and for tactile fermentus. So just turn and push up. Okay, now say the word 99.
99, 99, 99, 99, 99, 99.
Okay, so now tactile fermentus was heard. So now I'm going to check for bronchophony, and you're going to say 99 in a normal voice. Okay, go ahead.
99, 99, 99, 99.
So now I'm going to assess for egophony. And so what I'm going to have you do is I'm going to have you basically say E. Okay, so go ahead.
E, E, E.
So now I'm going to assess for egophony. So just say E, okay?
E, 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 E.
Okay, so I did not hear any consolidation over the lungs. All right, so I just suspected his abdomen. I did not see any scars. I did not find that there's anything pulsating. Now I'm going to auscultate his vascular sounds. So I'm going to look at the abdomen. I looked through the abdominal aorta, the renal arteries, iliac arteries, femoral arteries, and there was no bruise at all. I'm going to be looking in all the 4 quadrants and seeing if the bowel sounds are normal. Okay, so all bowel sounds were normal and nothing was hyperactive. Okay, so now I'm going to palpate all the 4 quadrants, and you just let me know if you feel any tenderness, okay? Did you feel tenderness at all when I was palpating?
No.
Okay, so now what I'm going to do is I'm going to assess, it's called the psoas sign. So what I want you to do is bring this right leg back. Yes. Okay, do you feel anything when you do that?
No, just a stretch.
Okay. And then the next one I want you to do is called the obturator sign. And this is what you're going to be laying on your back. And then I want you to pick up your right leg and just kind of bring it up. Did you feel any inflammation or did you feel any pain?
No.
Okay, you can bring it down. So that will look for... Okay, so now I'm going to assess your kidneys and basically to see if you have any issues when I do palpate them, okay? Do you feel anything when I palpate there? No. Okay, what I want you to do is I'm gonna basically go on your backside and you're just gonna tell me if you feel any pain, okay? So now I'm going to palpate and percuss the urinary bladder. Sit back. Do you feel anything?
No.
Okay. I'm gonna just go on your backside And just kind of move up a little bit. Did you feel any pain?
No, not at all.
Okay. Okay, so I inspected the hips. I did not notice any edema. I did not notice any bruising or ecchymosis, and I did not notice any deformities. So I palpated his anterior surface, the superior iliac spine, the greater trochanter and ischial tuberosity, and I did not notice any tenderness or any deformities. So now I'm going to assess to see if he has any effusions in his knee, to see if there's any swelling or tenderness. Okay, I notice that there's no swelling at all, and let me see the right or the left. There's no swelling in bilateral knees. So now I'm going to assess his knee range of motion. So what I want you to do is I want you to flex and extend your knee. So go like this and then back down. Okay, and the other leg. Okay. Do you notice any what's it called? Tenderness or inflammation when you do that? Does it hurt?
That seemed normal.
Okay, and then I want you to do is I want you to what's it called? Rotate them like this. Okay, so now I'm going to assess I'm going to do the anterior jaw test. So what I'm going to do is I'm going to have you lift your leg up. I'm going to pull this way, okay. Do you feel anything when I pull that way?
No.
Okay, I'm going to go on the other side, okay? All right, lift your leg up for me. Thank you. And then I'm going to push this way. Do you feel anything when I pull your leg that way?
No.
Okay, that was a negative assessment. Okay, so I assessed his ankles and his feet. I did not notice any edema bilaterally. Okay, so now I'm going to assess his pulses. So I'll assess your femoral pulse. And then I'll assess the back of your knee. This is called the popliteal. And then I'm going to assess this dorsalis pedis. And then I'm going to assess the posterior tibial pulses. Okay, so they are all present. And then I'm going to assess your femur over here. I'm going to assess your popliteal back here. I'm going to assess your dorsalis pedis. And I'm going to assess posterior tibial. Actually, the other side. Okay. So now I'm going to assess the dorsiflexion versus plantar flexion. So you're going to basically move your feet up, which is the dorsiflexion, so go. And this is against resistance. And then you're gonna do plantar flexion, so go. Okay, so there was no resistance in both feet. So now I'm gonna go ahead and assess his sensations with dull or light touch, which I'm gonna use a toothpick, so I'm gonna go ahead and assess his touch on his feet. Okay, so here we go. Okay, ready? And tell me if you feel this.
Yeah.
Okay, let me feel the other side.
Yeah.
Did it feel sharper on either side?
It's about the same.
Okay. So now I'm going to assess his bicep tendon. So now I'm going to assess his triceps reflex. Okay, ready? So you're gonna bring your arm out. Okay, so now I am going to assess your brachioradialis. Okay, and then I'm gonna assess. Now I'm going to assess his patellar reflex. And bow and both. Now I'm going to assess his Achilles tendon. Ready? Now I'm going to assess the Babinski reflex. Okay, so that wasn't a negative assessment because he did not fan or curl his toes. So now I'm going to assess for stereognosis. So I'm going to have him ID an object by feeling. You're supposed to close your eyes. Oh, I had to tell you that in the video. So I'm just going to assess his gait. So I want him to go on his heels, and then I want him to go on his tippy toes. All right, so come towards me, and I want you to go on your heels first. Okay, and then go back, and then go on your tippy toes. Okay, come to me. Okay, so his gait is steady. So now I'm going to be doing the wrong bird test. So I want you to stand there, close your eyes. Okay, so this is a negative assessment. He was not showing that he was swaying during the test.